Patients as Partners Award. It's the GP case conferencing, the impact on patient engagement.
Girls, what y'all trying to do?
So, tell us a little about the project.
Okay, so the project is part of a collaboration and affiliation called the Diabetes Alliance, and we are associated with the Primary Health Network and also the Diabetes Greater Newcastle sector and John Hunter Hospital Endocrinology. And this has come about because of the clinical lead, Dr. Shyam Acharya, who unfortunately can't be here tonight. And it's about taking the endocrinologists and also the clinical support staff, clinical nurse consultants, out into the GP rooms. And it's about educating GPs and patients within the area that they are most comfortable with, which is within their GP rooms. And the Alliance project is certainly a collaborative area, a collaborative space between Primary Health Network, and also the reason it's been so successful is because of the sponsorship that we have received at CEO level. So that's with Hunter New England Health, of course with Michael, and also, and I'm sorry, I did write down, the CEO of PHN, which is Richard Nankervis. So this couldn't have been made possible without a very high level of executive sponsorship and also support from our Primary Health Network partners with the patient support officers who help to support us in the actual program within the GP surgeries. And we use what's called a PAM, which is a patient activation measure, which is where patients are able to actually rate their readiness for acceptance of treatment. So we're able to know where they stand with their knowledge on their diabetes management, medication, and we can then rate their readiness to be involved in activities for better improving their diabetes management. And then 6 months later, when we go back to the practice, we also do the score again and we can see if there's been a positive or a negative improvement. So it very much helps the endocrinologist and the GP at the time and the clinical nurse consultant that's in the room to be able to tailor the education to the patient.
Awesome.
So it's a very positive experience.
And who are your lovely peeps on stage?
Lovely peeps on stage. One of the clinical nurse consultants that's heavily involved, particularly in the rural program, is Susan Nuna, and one of the patient support officers is Tanya McLeish. Woohoo!
Thank you.
Thank you.
That's good.
That's what you want.